Hi there, Dr. Lewis Cady coming to you from Cady Wellness Institute with a provocative thought to begin your week. In Austin, Texas, this last weekend, I gave the first part of my bioidentical hormone replacement therapy course, this one, Mastering the Protocols of Hormone Replacement Therapy, 16 hours of CME. And among other things, I talked about the on-label or on-guideline use of hormones and what is not on guidelines. So one of the things that we covered was this concept of hypoactive sexual desire disorder in women. And the only guideline approved use of testosterone in women is for hypoactive sexual desire disorder. So I thought I would illustrate that with this image, which is hypoactive tire tread disorder. Now, is that a thing? I mean, when you wear your tire treads down on the car, is it a disorder or is it just a thing? Does it just happen because the tires are getting old? So I'm concerned about anything being labeled a disorder in women that is simply a function of their declining testosterone, which is going to happen. In the same way, I wouldn't talk about a dude with hypoactive sexual desire disorder. I'd say the dude's testosterone is getting low and we should set about fixing it. So, interestingly, not only are women stigmatized by talking about their having a disorder, but after the guidelines say testosterone is the only approved use for it is to treat hypoactive sexual desire disorder. Guess what? There are no FDA approved testosterone medications for women. None. There are 0 that are approved. So I got a couple here for you. These are not FDA approved. These are compounded. So this is what we would call transdermal testosterone. That's a little toppy click. Pop the top off, click the thing one time, and out on the end comes 1/4 of a gram of drug. Now this is placebo, so don't worry, I'm not going to dose myself. But this is one way to do it. And for a woman, it's applied just like testosterone. You put it right there, put your wrists together, rub them together for 30 seconds, drive it into the skin, and you're done. This is an even less fuss way to do it. This is called a mini mega pump, because there's a mega pump and this is the mini pump. So it's the mini mega pump. Fits nicely in purses. One little squirt. That's a dose. And so it'll go on the wrist too. So that's how you would dose it from a mini mega pump. And the dose can be calibrated up and down to the nearest like 1/10 of a milligram. So we dose it to response, and also we watch the labs very carefully. So I want to just let you know, even though in my psychiatric literature there is a diagnosis called hypoactive sexual desire disorder, which is exclusively in women, I don't believe it. I think it is a normal physiologic drop in testosterone. The decrease in libido is predictable and it's easily fixable. So let's stop stigmatizing women. Let's not talk about a sexual desire disorder. Let's just say, hey, their testosterone is low, and by the way, we can fix it. Thanks for watching.